Mainly just a career search in college. I knew I liked science and biology, and I had a good friend get me set up with a kind of an externship with an internal medicine residency in Orlando. So I spent some time following residents around and really kind of fell in love with it from there. Really, it was the complexity of the diseases and how every day and every patient is very different. So it was more of a challenge than some of the other options for me. I see chronic inflammatory diseases that are caused by the immune system. I also take care of patients with osteoporosis and do see a little bit of chronic pain patients as well. So we do our best to make patients feel like they're an individual and not that they have a disease or labeled with a specific title or a specific name. I like to treat patients before the disease, so try to figure out what the patient needs and what the best choices are for them, rather than throwing just tons of medications at them. For rheumatoid arthritis, we have all kinds of choices from pills to infusions to shots that you can take at home. For lupus, we have infusions, we have modern therapies, and we have access to clinical trials for a lot of our processes as well. It's really collegial. We try to work as a team to take care of the patient. Wilmington Health is a fantastic place to be because there's so much communication between the docs, so everybody tends to know what the other hand is doing, which is really beneficial, especially in patients with rheumatic diseases. Though they're complex, the diseases are systemic, so they affect the heart, the lungs, they affect the joints, they affect the whole person. So I often need help from my internal medicine colleagues, cardiologists, pulmonary, nephrologists. So I work with a lot of different specialists and then really rely on the primary care doctors to make sure everybody knows what everybody else is doing. I'm trying to learn how to surf. So I've been doing it for about a year now and it's going well. Water's really cold right now, but still getting out there. It's fun.